Hi. Hi, ladies. Good evening. It's been some time since I did a live talk. Okay, today I am going to talk about PMB. Okay, today PMB. I will explain to you what is PMB. Before that, let me share the screen. Okay. Okay, PMB is post-menopausal bleeding. Okay, I am Dr. Anil Jikedas. I am an obstetrician, gynecologist, and urogynecologist at Bagan Specialist Center. So, what is PMB or post-menopausal bleeding? Post-menopausal. So, before that, menopause is when there's no bleeding, no more period for 12 months from the last menses. That means, say, it occurs at the age of between 45 to 56, but average age in Malaysia is around 51 years. Okay, so say at the age of 50 years old, you stop having menses. And for 1 year after that, no bleeding at all. That means confirm your menopause. There are few ways to confirm. One is no bleeding, or otherwise we can do some blood tests. So post-menopausal bleeding is any bleeding that occurs after menopause. Once you menopause, any bleeding that is called post-menopausal bleeding. And what we are worried about is basically cancer, cancer of the genitourinary tract, of the uterus or the vagina or the cervix or anything like that. So that's why recently I had few cases of postmenopausal bleeding, and it is quite worrying because they don't seem to know, they take it quite lightly. So that's why I decided to talk about this. So this is the female pelvis. This is your uterus. The uterus consists of the cervix, the endometrium, the inside part of the uterus, where every month you menses or the pregnancy is inside here. Then the myometrium or the muscle of the uterus. Then there's the vagina, tube, ovary. Okay, this is the front view. This is the side view. You can see the uterus. The urine bladder is just in front of the uterus. And this is the bladder. This is called the urethra. This is where the urine comes out. This is where the urine comes out. Vagina, this is the rectum. Okay, so please be familiar with the organs and structures here. So there are many causes. Postmenopausal bleeding, there are many causes. And basically, what I will do, I'll explain and divide the causes of bleeding from the vagina, from the urethra, basically from here, from the cervix, endometrium, ovary, tube. But the commonest cause of bleeding is basically vaginal dryness. That means after menopause, because of the decrease in the hormone level, the vagina will feel dry. So bleeding from the vagina, GSM, commonest cause of postmenopausal bleeding is something called GSM, that is genitourinary syndrome of menopause. The old term is vaginal atrophy. This is because of the lack of hormones, basically the lack of estrogen, which cause thinning of the vaginal tissue. Okay, vaginal mucosa, we call it. The vaginal, the layer, the skin of the vagina, it causes thinning and dryness. And because of that, sometimes get infected and cause bleeding, or when you have sexual intercourse with your partner, it can cause bleeding also. Then other causes are those who have prolapse, those insert vaginal pessary after some time, because the pessary is a bit of silicone and something hard, you will press on the vagina and it might cause some infection and therefore lead to some bleeding. Or vaginal infection, menopausal ladies very prone to infection because of the lack of hormone. Reduce in hormone, other bacteria will come in and cause infection and lead to infection, cause inflammation, redness and all that, and cause bleeding. Or if there is a growth, growth in the vagina or cancer of the vagina, this can cause bleeding. Okay, as you can see here, this is the cervix. In a menopausal woman, the cervix become very short already. Sometimes it is flush. It is together with the vagina, and this is the typical, when we do the examination, this is the typical feature. Okay, you can see, this is the one, the redness is basically blood vessels which are broken and it causes bleeding. Another common place where bleeding can occur is from the urethra orifice. From this is where your urine comes out. So something called urethral caruncle. Okay, very, very common. Okay, you will see those ladies who are above 50, very common to see this. It is basically benign growth around here, blood vessels and the tissue here gets swollen and it looks like a polyp. You don't have to do anything. If it's bleed, usually we just give some hormone cream, that's all. And usually if it's big or if it's like too big, disturbing you, usually I refer to the urologist who will handle this problem. Then the cervix. Okay, the cervix is the one part of the uterus. Infection of the cervix, cervicitis, like infection of the vagina, infection of the cervix, cervicitis, or any pre-malignant lesions. If you don't do pap smear, because of HPV infection, there is some pre-malignant lesion, like it is called CIN, cervical intraepithelial neoplasia, or now the new term is high grade or low grade SIL. This may cause bleeding. Cervical cancer, okay, those who don't screen at all, those who are high risk, cervical cancer, or another type of growth which is common in the cervix are called cervical polyps. Okay, cervical polyps are usually not cancerous. It is benign growth. This can cause bleeding also. So this is when we examine, we can see this red thing. This is your cervix. This is the cervix. This is the vagina. You can see, and this is a polyp, where quite common also. It is basically a growth, benign growth lah. It is not cancerous. It protrudes through when we examine, you can see it protruding through the cervix, and when you touch, it bleeds. So sometimes when you have intercourse or accidentally, for some reason, you have some bleeding, this might be the cause. So these are from the cervix. And this is a typical appearance of cervical cancer. Okay, this may be early stage, late stage, it may be worse. Okay, this is how cervical cancer look like. Then the uterus. Bleeding also can come from the uterus, from the endometrium. Endometrium is this part inside the uterus. Polyps also can grow inside there. Okay, polyps, it is like small growth. It's sometimes the size of a grape, or sometimes size of a nut, small peanut. Polyps. This also benign, usually not cancerous. Endometritis, infection of this part of the uterus, and infection of the uterus. Endometrial hyperplasia, this one can be worrying. Endometrial hyperplasia means swelling of the cells inside this part of the endometrium. Okay, endometrium hyperplasia is like pre-malignant cervix cancer lah. This is if you don't take care of this, it can change to endometrial carcinoma. And another common, what we are worried about is those who come with bleeding is endometrial carcinoma. Carcinoma is cancer of the endometrium, the inside lining of the uterus. Okay, this part we are quite worried. And uterine sarcoma. Sarcoma means cancer of the muscle of the uterus. All these are possible causes of bleeding after menopause. Other causes which can cause bleeding is if those who are on hormone replacement therapy, if they don't take it properly, or sometimes for certain reason, they can cause thickening of the endometrium, cause bleeding. Those who are breast cancer on tamoxifen, tamoxifen is known to increase the thickness of the endometrium. Or those who have heart problem for whatever reason, they are taking aspirin or warfarin, also can be prone to bleeding. Then those ladies with prolapse, prolapse of the uterus, or prolapse of the vagina, or prolapse of the bladder, urine bladder, when they wear the undergarment, that part rubs against the undergarment, and after some time it forms ulcer and can cause bleeding. Okay, this bleeding all we are not very worried, but can be worrying to the lady. And very rare causes is sometimes fallopian tube cancer also. When we see everything, there's no cause. Sometimes this one is very rare. I myself haven't seen, but can be a cause. And sometimes it can be just unknown. So if it's everything, we rule out everything normal, then it can be just unknown. You don't know what's the cause of the bleeding. So once you have this bleeding, once you come in, what I advise is to go and see the doctor. And when you see a doctor, when you see a gynecologist like me, first thing is we will want to find out about the bleeding. That means the onset, when the bleeding started, how long have you been having the bleeding, the amount of bleeding, whether there is pain, what is the quantity, how many pads you use a day, whether it is like just spotting or whether it is fresh bleed, all those kind of things we will know. We will want to know. Then another thing is we ask you if you have feel any lump in the abdomen, any growth in the abdomen. That can be maybe a old fibroid or ovarian or whatever growth. And then if we have any bleed after you have intercourse with your partner, okay, this is called postcoital bleeding. This one, what we are worried, things like the polyp or like cervical cancer or infection of the cervix and all that, all this can cause, or anything in the vagina can cause bleeding after intercourse. And then we'll ask if you had any pap smear. When was the last pap smear? Any recent pap smear? Okay, if you have done a recent pap smear and it's normal, then we are not worried about cancer of the cervix. And any previous history of bleeding or in previous surgery or whatever previous surgery, any vaginal problems, we will ask. And also medication, like earlier I mentioned, any warfarin, any using any hormones. And after that, we will do an examination. Okay, examination, general examination, we check the general, we see whether if the bleeding is very heavy, usually there'll be a pale appearance. And then after the general examination, we do an abdominal examination. Okay, we palpate the abdomen, we check the abdomen, we press and see whether there's any growth. Okay, any like huge growth, any like maybe a uterus. First, growth means only two possible things. One is uterus, one is ovary. Any growth. And after that, we do a speculum examination. Okay, this is called a speculum. We will put this device. It's a speculum, a duct. It's a look like a duck bill. We will put it inside the vagina to look at the cervix. Okay, when we put it properly, we can look at the cervix. We can see whether the cervix is healthy or not. And also we can look at the vagina. The speculum we use is a clear plastic speculum. So when we insert it, we can also inspect the vagina. We see the vagina if there's any lesion, any unhealthy lesion. Most of the time, we see the atrophy, like earlier, the one picture I showed you, all the redness around the vagina. And if the pap smear not done, we will do a pap smear. Okay, we use this device. We put the brush to take the sample from the cervix. Or some people, they insert this to take sample from inside the uterus also. It is called endometrial sampling, PEPAL. Those people who, some places, some centers, they do it. Okay, this one can be done in the clinic. You don't have to take to the theater, no anesthesia. You can just take sample, but sometimes it may not be accurate. So I use another method. So we do the speculum examination, and after that we do a bimanual pelvic examination. That means 2 fingers inside the vagina, one on the abdomen like this, and we feel for the uterus, whether uterus is moving or not. All those examinations for the pelvis, we see whether we can feel any growth in the pelvis and all those kind of details. Whether sometimes when we insert, there will be pain. Okay, pain may be caused by infection, all those kind of things. Oh yeah, another thing is when we do the speculum examination also, if any discharge, any whitish discharge or anything which is common, we can take a swab also. Okay, so after the examination, pelvic examination, we will do an ultrasound. Okay, ultrasound. Ultrasound, basically what we do this ultrasound in the clinic. We do 2 types of ultrasound. One is abdominal and one is transvaginal ultrasound. Abdominal ultrasound is the normal ultrasound, which we put a probe on the abdomen. Okay, from here we see the uterus, we see if there's any growth, and we see anything abnormal of the pelvis. And those who are a bit obese, those who have thick abdominal wall, sometimes it's very difficult to see the uterus. So we have to do a transvaginal ultrasound. Okay, and those who have postmenopausal bleeding, it is mandatory. Okay, it is mandatory to do this kind of ultrasound, transvaginal ultrasound, because we want to see basically what we are interested in is the uterus and the thickness of the endometrium inside here. Okay, sorry. What we are interested in is this part. This part is called the endometrium. Okay, so when we do the transvaginal ultrasound, we want to know, we measure the thickness of this part. If the thickness is more than 0.5 centimeter, then we have to take a sample of the tissue. Okay, that is very important. If it's less than 0.5 centimeter, then we can just observe. But if it's more, then we need to do a sample to just rule out any pathology like cancer or hyperplasia, as I mentioned earlier. So this is what we see sometimes when we do the transvaginal. This is a typical transvaginal. This one you can see, this is very thick. Okay, this distance, you can see it is about 1.3 cm. And you can see black thing around here. If when you see black in the ultrasound, when you see this kind of dark black kind of thing, is more likely fluid. Fluid either is just some fluid or it might be blood. And this one may be a polyp. Okay, you can see the black thing all around and a stalk. This might be this is sometimes a polyp will look like endometrial polyp. So we have to remove this. But when we see something like this, and we see something like this is the uterus, and this is the endometrium, the inside part. And when you see this measurement is about 1.7 centimeter. This one can be very worrying. Okay, this one, it is those postmenopausal women, if you have a thickness like this, it is mandatory to take a sample to check. This one most probably can be cancer. This is what we are worried. So that's why transvaginal ultrasound very, very important. Those who just done trans abdomen is not enough. Unless those who are very, very thin ladies, say about 40 kilo, 50 kilo, very thin abdomen, no fat, then maybe can see lah. But still, what we prefer is a transvaginal ultrasound. So diagnosis, we from our examination, from the history, the type of bleeding, the pattern, then from the examination, from the speculum examination, bimanual, from the ultrasound, roughly we will come to a diagnosis. What we can see, we diagnose from there. But sometimes, if we don't see anything, we may need to do further investigation. So further investigation will be like CT scan or MRI. CT scan, MRI, if we suspect cancer or there's any obvious growth. If we think it is like we see the uterus is enlarged and look a bit funny, abnormal, maybe we do for uterus, better to do an MRI. Or if we see any like cyst, any huge tumor, or we suspect it is cancer of the cervix, then we will do a CT scan. All this to further to see the size of the uterus, to see whether things are stuck, to see any lymph nodes enlarged, around that. And the next step is if CT scan not required, if you see the endometrium thickness, like earlier I showed you the 1.7 centimeter one, we will proceed with a hysteroscopy and endometrial curettage. And if there's a polyp, we do a polypectomy. That means removal of the polyp. So what is hysteroscopy? Hysteroscopy basically is we put a camera inside the uterus. We scope the uterus. Okay, we have this one is usually done under anesthesia. We put you to sleep, and then we will insert a speculum. We try to dilate. We use a device to dilate the cervix. We make the cervix bigger, and we put this instrument in, this telescope, into the uterus, and we look at inside the uterus to see what is going on. So this is done under anesthesia. As you can see, this is a camera, this is the scope. We will put inside, and then through the monitor, we will see inside of the uterus. And you can see this picture, most probably nothing wrong. This one is everything clean inside. So I show you some images. Okay, if there's a polyp, it will look like this. These are polyps. You can see like this kind of peanut size, or sometimes it can be a bit bigger, pea size, or depends lah, varying size. Structures inside the uterus. I'll show you some figures. Okay, this is a typical postmenopausal. Those ladies who are menopause and maybe they come with bleeding. This one you see inside. This is inside the uterus cavity. This is where you develop inside your mother. Okay, this is inside the uterus. Okay, as you can see, this one is very clean. Okay, nothing. After menopause, even the tissue and all that, okay, everything is atrophic. This one I did. This lady I did about a month back. She had bleeding, but when I scoped, it was all redness inside. Nothing wrong. Okay, nothing to scrape. Also, no tissue. It's just atrophic. Okay, just because of this redness, the bleeding there. So this one nothing to worry, nothing to do with inside. But if you see a structure like this, this is typical of polyp. This is what a polyp looks like. Okay. Usually you can see things. This one is endometrium tissue. You can see things like this. This kind of growth usually inside the uterus. Sometimes this one can be normal, or if there's too much of this, it can be hyperplasia, swelling of the cell of the endometrium, or it can be cancer. Okay, if there's too much of this. And this one also quite common, polyps. This one, what we do, we put something, forceps inside, and just remove it. Okay. So these are what we can see inside the uterus. Treatment for postmenopausal bleeding, it depends on the cause. Okay, it depends on the cause. As I told you, vaginal dryness is the commonest cause. Vaginal atrophy, commonest cause of postmenopausal bleeding. So for this, usually we prescribe a hormone cream, usually estrogen cream, to apply in the vagina. So after you apply, it will become like better back. You'll feel better. You feel more moist. Okay, and you have intercourse with your husband or partner also, you'll feel better. And sometimes this also can help with the urinary symptoms. Okay, because what happens is the uterus, the vagina also becomes shrink a bit. So it will pull the structure in front. As I showed you, in front the vagina and the uterus is the bladder. So sometimes after you give this cream, the symptoms will be better. And also this has shown to reduce vaginal infection. Okay, vaginal infection is also cause for urine tract infection. Okay, those who have vaginal infection, the infection from the vagina goes inside the urine bladder and cause recurrent frequent urine tract infection. So this cream can help relieve all that. Then if there are any benign growths like these polyps or sometimes funny things, there's growth in the vagina or the cervix or inside the uterus, we just excise, we just remove. If there's prolapse, depending on the stage of the prolapse, I do vaginal surgery. Okay, scarless vaginal surgery. That one I can do. Or if there's any hyperplasia, say there's a hyperplasia, endometrial hyperplasia, swelling of the cells of the endometrium where you, if need to remove the uterus, okay, so at that time what I will do is, I can, if it's the uterus is coming down at a certain extent, we can do vaginal surgery. We can remove the uterus from down. You don't have to cut the abdomen to take out the uterus. So all this is like scarlet surgery. And if there's cancer, depends on the stage. If early stage, if we can do the surgery, we will do the surgery. Cancer, there's no shortcut. You need to open the abdomen. You have to cut abdomen open and remove, whatever need to be removed. Usually we take out the uterus, the tubes, the ovaries, and sometimes we remove the fat. I'm sure you've seen some of my images which I put in my Facebook, okay, of those like ovarian tumor and all that. We remove all that. But if it's a bit more advanced cancer, I usually refer to the gynae oncologist who will do a better job. Or if the stage is advanced, those cannot do surgery, then we refer to the oncologist for either chemo or radiation. Okay, so summary: postmenopausal bleeding is bleeding after menopause. It's quite common. Okay, so please, if you or you have any of your say your mother, your aunties, or anybody elderly who have this problem, please ask them to come and get it checked. Okay, it can be a serious matter. It can be a normal thing, or it can be a very serious matter. So mandatory, if you have bleeding after menopause, mandatory to see doctor to investigate. Needs vaginal examination and scan, preferably transvaginal scan. There are many causes, like I told you. It can come anywhere from the genitourinary tract. Treatment is depending on the cause. Commonest cause, vaginal dryness, and commonest concern, what we are concerned of is cancer. So if you want to have an examination or for more information, you can contact me through my Facebook page. Okay, you can WhatsApp me from there. You can go to my Facebook page. This is my Facebook page. You can WhatsApp me from there to get an appointment. Please like, please share, and thank you very much. As I promised, starting my live talk to give you all more information on common things lah, common things which can be dangerous. So thank you very much. Thank you very much for listening. Please share. Please also, if you have any ladies who have this problem, please tell them to come and see. Thank you very much. Good night.